My name is Ashley Lindstedt, and welcome to my presentation on heartworm disease. I have been a certified vet assistant for approximately 3 years, and in that time have educated owners, diagnosed, and treated multiple cases of heartworm disease in canines. But what is heartworm disease exactly? Imagine an infestation of microscopic organisms that inhabit the heart and blood vessels of the lungs. Now imagine those same organisms growing to be about 12 inches in length, clogging the heart and lungs, and causing symptoms such as tachycardia, which is a rapid heart rate, congestive heart failure, and in severe cases, death. Unfortunately, heartworm disease is one of the leading causes of death in our canine companions, with over 500 cases reported in Florida alone from the year 2000 to present day, even though it is 100% preventable. Having said that, heartworm disease would be far less prevalent if owners were able to recognize associated symptoms, have their pets regularly blood tested, and follow a prevention plan. Symptoms of heartworm disease do not always show themselves until damage has already occurred to the pet's body. Some pets may even be asymptomatic, not showing any symptoms at all. Symptoms of heartworm disease can vary from exercise intolerance to death. Here are a few additional examples. Pets with an occasional cough due to lung damage may be designated as having stage 1 heartworm disease. A more severe case of this, known as hemoptysis, includes the spitting up of blood caused by hemorrhaging in the bronchial or pulmonary regions, indicating blood clots in the lungs, and may be designated as having stage 3 heartworm disease. Anemia, which is a deficiency of blood cells in the body, causes symptoms that are a result of insufficient oxygen to the muscles and organs. Pulmonary hypertension, which is an elevated blood pressure in the lungs, can cause the right side of the heart to increase in size in order to keep up with the increased rate of circulation. This constricts the circulation on the left side of the heart and can cause weakness and fainting. Obviously, it is not recommended for you to wait until your pet becomes symptomatic. Testing is done on a regular basis to ensure your pet is heartworm free. There are many different techniques of heartworm testing. 2 of the most common include the microfilaria test and the heartworm serology. A microfilaria test is used to detect the presence of baby heartworms, otherwise known as microfilaria, in the bloodstream. A more accurate form of testing, known as the heartworm serology, tests for the presence of protein in the bloodstream that is produced by the adult heartworm. Some pets may test negative for microfilaria and yet test positive for adult heartworms in the heartworm serology. Heartworm testing is recommended on an annual basis for pets that are not on a regular preventative plan, and once every 2 to 3 years for those pets who are on a regular prevention plan. Heartworm prevention comes in 3 main types: an injectable, an oral tablet, and a liquid topical. The injectable can last for up to 6 months at a time and is very convenient to the owner. It may also be used as a prevention for some intestinal parasites. An oral tablet, used on a monthly basis, may be a combination of medications for multiple parasite prevention, including heartworms, some intestinal parasites, and external parasites as well. A liquid topical is also applied on a monthly basis and may also be used as a prevention for multiple parasites. Heartworm prevention can cost the owner anywhere from $15 to $20 a month, whereas heartworm treatment may cost anywhere from $1,200 to $1,800 for a single treatment. You do the math. In conclusion, we see that heartworm disease comes in many symptoms, in many forms. Heartworm testing is recommended in order to prevent the disease and to make sure your pet does not become symptomatic, but in the end, there's only one true prevention. Heartworm disease, unfortunately, is a growing issue in Florida, but is very easy to prevent as long as the owners are willing to learn. Thank you for your time.